namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And thank you for tuning in and watching our programs regularly. And of course, you can always download our podcasts at hotzepodcast.com. That's HOTZE podcast.com. Now we have another popular topic on tap, which are sinus infections. So many people suffer from that. But a lot of people don't know that there's a solution for that. They just suffer through all those horrible symptoms. Dr. Hotze, please help those sinus sufferers out there. What can they do?
Well, very interesting that we're discussing this at this time, because right now, when I went out to my car this morning, it was covered. Now, here we are it's not even, we're just in the last 10 days of February, and it's got a green film on it. And the green film, of course, it's already the tree pollens, oak pollens, and the other pollens have already started to pollinate. This is early, which is because we had a pretty cold winter. I'm surprised.
It was cold here.
But as soon as it warms up, and it's been warm for a week, all of a sudden, trees think winter is over, and they're going to start to pollinate ahead. Well, a sinus infection is caused by an underlying allergic disorder. And, of course, you have 4 sets of sinuses in your head. You got your frontal sinuses, your maxillary sinuses, your ethmoid, and your sphenoid sinuses. You have a pair, so they're one on each side. And these sinus are lined with mucous membrane. And if a person has an allergic disorder, they will make antibodies to normal occurring substances in the environment, things they breathe, like weed, tree pollens, grass pollens, dust mite, mold spore, animal danners. Can also be foods. And when they make antibodies, these antibodies are then attached to mast cells that line the mucous membranes, in our sinuses and our nasal passage down into the lungs and the bronchial tubes. And when these antibodies that have bound to the allergens are captured in the mast cell, they cause the mast cells to rupture and spill their contents. And it just so happens the content of mast cells is histamine.
Sounds a little familiar to people, I'm sure.
That's why people take antihistamines like Clarinex and, Zyrtec and Benadryl, whatever. And those are supposed to counteract or block the effect of histamine. By the way, something very interesting you should know. Vitamin C binds histamine, molecule for molecule. So if you have allergy attacks, you want to make sure you take a lot of vitamin C. And if you take vitamin C around the clock, and that will mitigate your allergies significantly, and it will also help prevent infections. But what happens now, in your sinuses, the tissue is swollen because the histamine's been released, and you begin to weep and begin to have drainage in your sinuses. It becomes a culture medium, really, for bacteria. And we've got bacteria all over, and so you breathe in some bacteria in the air, and next thing you know, it gloms onto the Petri dish. Now that's your sinus says you got an infection, and it's infecting, and you get yellow and green drainage, and you get swelling and pain and headaches and nausea. You get postnasal drainage. It gets down in the lungs, and oftentimes you get a secondary bronchitis. You can't clean up the lungs unless you get the sinuses cleaned up. So if you have a problem with asthma and recurrent sinus, you've got to get the sinuses cleaned up. And I don't mean by surgery. What happens to most people, they have these sinus problems and recurrent sinus infections, which causes the drainage holes in the sinuses to clog up with tissue so they don't drain. They get this swelling, and they get turbinates in their nose swollen. And they go to an ear, nose, and throat doctor. Of course, he's a surgeon. He's going to operate on them. Operation just takes away the mechanical problem secondary to the allergic reaction and the recurrent sinus infections. It doesn't clear up the allergies. So those people will get recurrent allergy problems again. So what you want to do is, if you have allergy attacks, that's the drainage, itchy nose, itchy eyes, recurrent sinus infection. If you got recurrent sinus infections, you have allergies. End of story. By the way, sinus infections can be caused by not only bacteria, but also you can get fungal infections in your sinuses. And that happens in some individuals. So when you have this recurrent and chronic allergy, you need to get that treated, and you need to address the underlying cause rather than simply treat the symptom with drugs, which most allergists and most doctors do. They just give you a drug. They give you decongestant, antihistamine, or now you can get that over the counter, or they give you some steroidal nasal spray. Well, what you need to do is need to be tested to see at what level you need to be treated. If you have symptoms of allergies, you have allergy. It's a clinical diagnosis. It's not a diagnosis made with skin testing. Skin testing is just, or even blood testing, simply tells us at what level to treat you. And we treat our guests at the OC Health and Wellness Center with sublingual drops. We literally take the very things they're allergic to, and we put them in such a diluted form that the body will immune system will stimulate the production of blocking antibodies that block the allergy reactions. We also can help neutralize those allergy reactions with the allergy drops. So those allergy drops will contain the common wheat tree, grass pollens, dust mite, mold spore, and animal danders to which people are allergic. And allergy is a cumulative problem. You may have worse problems in one time of season, like the weed season or tree season, but allergies are a cumulative problem, and foods can also cause problems. Wheat, corn, egg, milk, yeast, soybean are the big six. Any food could cause a problem, so it's the recurrent eating of a food to which you're allergic that causes compounding or concomitant food allergies. So the way to undergo treatment of your sinus infections is first and foremost, get control of your underlying allergic disorder. Once you control that, then you're not going to have your recurrent sinus or your bronchitis or your asthma attacks. If you have an acute sinus problem, we'd recommend neti pot irrigation. You want to irrigate it with saline, your sinuses, to flush out the bacteria.
And you would want to use filtered water for that, correct? Not chlorinated water when you're using an
Filtered
neti
water.
pot. So
Exactly.
be aware of that.
So colloidal silver is a natural antibiotic. You can use that. And then you also need to consider if you have recurrent and chronic infections, you may have low thyroid. That may be an issue, and that's why your immune system doesn't respond or heal well, because if you got recurrent and chronic infections, that tells you
That is a classic sign of low thyroid.
your immune system's not healthy. So you're going to need to be on some thyroid as well. Mm-hmm. So here's, in conclusion, if you've got recurrent sinus infections, you got allergy problems, they can be treated. You don't need to take shots. You can be tested and put on sublingual drops that you take under your tongue on a daily basis, 2 or 3 drops under the tongue. And you can do that at home. You don't have to drive across town. You don't have to worry about any allergy reactions. You'll do well on that. And we've used that literally on thousands of individuals here at the Hotze Health and Wellness Center. We started as an allergy center originally back in the late 1980s, 1989 and 1990.
Yeah, so we have treated thousands of people, and we know that there are people out there listening to us right now that suffer all the time from allergies. Just know you don't have to suffer any longer from that. It is so easy. All you have to do is give us a call at 281-698-8698 and let us show you a way that you can take allergy drops, sublingual drops. It's so convenient. It has great results. We've treated so many people, and we'd love to be able to serve you. 281-698-8698. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.